Now, when I see some cases, see that there are cases where they put the word desire, sometime craving. But when I like to little bit interact with you also, so I give you permission to write something in English also. In your practice, this is my question. My question is that in your practice, when a patient comes to you, do you hear I like it, or do you hear I desire it, or do you hear I have a craving? Which word is more popular in your practice? Please write your own options. I like it. For example, a patient says, doctor, during the sickness, I like to drink cold water, or he says, I have a desire for cold water, or he uses the word craving. Which word you often hear from your patient? You can write quickly if you want to write, so that I can know. Okay, Orna says like, Rachel says like, Ronan says I like, more of like. Very good. Okay. Then if you think that the patient says I like it, how do you convert this to desire? Why you put the word desire? For example, when you repertorize, okay, the patient used the word like, but you put you go to the repertory into the desire, isn't it? Yes or no? When a patient says I like it, if you use the only word in the repertorization like, or you convert it into the desire. Yeah, so you convert it into the desire. Why do you convert like into the desire? And why, and when do you use the word craving? Now the patient has no idea about homeopathy word, so, and we also don't know how, it means that every like means desire or craving. And when do you use the craving? I don't know how. Very often I see in the repertorization of many homeopaths, they use the word craving. Now, when a patient tell me something that, doctor, you know that I like ice, I like ice cream, I like tomato, I like chilies. Now my question, how I have to make my patient understand, because there is no word like in my repertory or in materia medica, but we have desire or cravings. But I have to understand whether like is different with desire and desire is different than craving. They are three different words in English, and also we have to understand them properly. Now, for example, I ask the patient, what do you mean by like? Have you ever asked the patient when he says, I like tomato? And if you have asked the question from the patient back, what do you mean by like? Yes or no? Forget about the language. Also, I will make you understand, Rachel. So please don't bring the language inside now, in Hebrew or in Hindi or in English or in Romania. That doesn't matter now. Now we are talking about the patient. So, okay, so I'm going slowly, very slowly with you. Have you ever asked the patient, what do you mean by like? This is the question. So what do you say? Yes, or you say the patient says like means like, or you have never asked, or when a patient says like, you immediately go to the repertory. This is my question. So friend, when a patient says I like it, like means somebody who enjoy it. I never asked. Tamara says I never asked. Okay. Is it because you are shy, or is it because you think it's enough? Like means desire. Okay, I continue further. Now, I have to ask the patient, what do you mean by like? So liking means, doctor, you know that I enjoy it. Liking means enjoy. I enjoy tomato. I enjoy eating ice cream. But do you like during, for example, when you have a fever, today you have a migraine, today you have come to me because you have blood pressure. Do you still like? No, doctor, now I don't like. So why don't you like now? So for example, when a patient says, I like something, the first question is, what is liking? And the second question is, do you still like when you are sick, or you only like it when you are? So there is a difference between a patient likes some certain things. For example, he say, I like hot water. When I have a problem in the throat, I like hot drinks. So like means, why do you take, why do you like it? Because doctor, I like drinking, tea. I enjoy drinking tea when I have a throat pain. I enjoy it. So liking means enjoy. Now the word comes desire. Desire is something which is unavoidable, which you can't avoid. So this you have to talk with the patient, okay? So for example, desire is something is I'm longing. I'm longing. You know, doctor, since I have become sick, I'm longing for my drink. You know, there is a great wish. Desire is a great wish. Doctor, I have a great wish that to drink something hot. I like, hot chocolate. So are you drinking if you are taking hot chocolate, or is it only a desire? No, doctor, I'm not drinking hot chocolate, but there is a desire, you know. Every day in the morning I get up, I wish that I should drink hot chocolate. But are you drinking it? No, I'm not drinking it. Why you are not drinking it? Because doctor, I think it will not suit me. But I have a desire. So you see, desire is the one which the patient is not using it. Okay, but this is unavoidable. He can't avoid his desire. So desire is in the back of the mind all the day. Doctor, I think that when I get better, I will drink hot chocolate. When I get better, I will drink hot chocolate. So you are not drinking. Yes, I'm not drinking it. So when a patient, so this is called desire only. So desire is a wish only. I wish that, doctor, you know, that somebody will bring me hot chocolate, or I wish that I should go to the coffee shop and have my own coffee. But patient is not doing it. This is only a liking. So when a patient says, I like something, you have the question, it is a very common question in our mind, has to come as a homeopathic physician. What do you like, and are you doing it or not doing it? And then comes the word craving. Now the craving means something abnormal. Desire is unavoidable and craving is abnormality. For example, a patient has a craving. He said, doctor, you know that when I can't stop myself drinking hot chocolate, even I know that it doesn't suits me. Even it aggravates me. So whenever I drink hot chocolate, I have a sweating, but I still have a craving for that. So craving is abnormality in the body. It means that something which body is missing. Something which, for example, hot chocolate. So why the patient is taking hot chocolate as a craving? Because there is something in the hot chocolate which the body needs, but the patient is doing it abnormally. So craving is abnormal. Desire is unavoidable. Liking is which you enjoy. So you have to understand from the patient when you hear the word that, doctor. So and another question is, if you still like it or you don't like it. So the degree of liking, that is very important. How much do you like it now? For example, a patient says, whole of my life, I like to eat cold things. I enjoy cold things. This is not desire. This is enjoyment. So the question is, you still enjoy your cold drink? No, doctor, now I have a desire. I have a desire to have this cold drink back, but I'm not doing it. I'm not taking it. Okay. So who takes it? That goes to the craving. Now this is